All right, principles of pharmacology. This is chapter 12. All right, here's your AEMS education standard. Pharmacology applies to a patient assessment and management of fundamental knowledge of the medications carried by an advanced AEMT that may be administered to a patient during an emergency. So we'll have to have some medication safety, some kinds of medications used during an emergency. Legislation, naming, classification, storing, and security. So its mechanism of action, how it's metabolized and excreted, its response in relationship to other medications and interactions. So we can administer certain medications, help patients self-administer some of their medications. This drug profile gives us all the specifics about that drug, including how the package insert and listed in various pharmaceutical publications. So pharmacology is the studying properties of the effects of drugs and medications on the body. Drugs are the chemical agents used in diagnosis, treatment, and prevention of disease, and medications are chemical substances used to treat or prevent disease and relieve pain. A dose is the amount of medication that is given, and an action is a therapeutic effect or intended effect that that medication is expected to have on the body. There are some unintended effects, and these are undesirable, but pose little risk on the patients, and untoward effects they can be harmful to the patient, and toxicity, which is a substance, will pose a health hazard to an individual or organism. The indications are the therapeutic uses for a particular medication, and contraindications are times when you should not give a patient that medication. All right, drugs are usually derived from four principal sources: animals, vegetables such as plant sources, minerals, and synthetic compounds. The trade name is the brand name from the manufacturer. Proper nouns that begin with a capital letter, and the medication may have been many different trade names depending on how many companies manufacture. The generic name is usually the original chemical name of the medication. It's usually suggested by first manufacturer and approved by the FDA. And all medications licensed for use in the United States have their generic names placed in the United States Pharmacopeia. The chemical name is the precise description of medication's chemical composition and molecular structure, and the official name is the name assigned to it by the USP. So here's the chemical name. There's the generic name, and then there's the trade name, Vanseril. And then the official name is what's in the USP, and it's usually got USP behind it. Prescription medications are distributed by pharmacists according to the physician's order, and over-the-counter medications are purchased directly without a prescription. All right, so the FDA is the Center for Drug Evaluation and Research. They have what they call a PDR, a physician's desk reference. I think there was an ad for that. A lot of times you can find them on nursing desks also. And I'm sure there's a website for this too. That hospital formulary delineates which drugs are used in a particular facility or agency in our case. Okay, not all drugs are used at every agency, and it's dependent on what your patient needs are in your particular region or area. The drug inserts are placed in there, and then the internet itself can be a good resource. Be familiar with all these resources and field references, particularly regarding medications encountered in the pre-hospital setting. So manufacturers of pharmaceuticals is subject to a variety of laws and legislation and regulations. So in the United States, drug standards are published in the USP and the National Formulary. So it is, this is intended to help protect the consumers. It prohibits manufacturers from making false claims about the benefits of the drugs. It prohibits companies from advising patients on the administration of the drugs. It requires manufacturers to publish information on the side effects and the known potential harmful effects of the drug. So outline standards for drug manufacturers are to ensure that drugs produced by different manufacturers are uniform and are in strength and purity. Some drug-related legislation, the Pure Food and Drug Act in 1906. This was the first federal drug-related legislation in the United States, but it protects the public from foods, medications, alcoholic beverages that may be mislabeled, poisonous, or otherwise harmful. The Food, Drug, and Cosmetic Act required drug makers to label their products, indicate whether they contain potentially harmful substances, and to include warnings about possible side effects. Okay, it's authorized creation by the FDA. It is mandated by that dangerous drugs could be dispensed only with a prescription. All right, the Harrison Narcotic Act, it regulated the import, manufacture, prescription, and sales of several non-narcotic drugs and cocaine, opium, and their derivatives. The Narcotic Drug Control Act increased penalties for violation of the Harrison Narcotic Act and made heroin and marijuana illegal. Controlled Substance Act is comprehensive legislation dealing with narcotic and non-narcotic drugs that have a potential for abuse. So there's specific requirements for registration, procurement, storage, distribution, record keeping of these drugs, and penalties for failure to comply with these requirements. As drugs covered are classified into 5 categories or schedules according to their abuse potential. So Schedule 1 drugs have the highest abuse potential. Schedule 5 include drugs with the lowest abuse. So be aware of the laws in your state and always follow your local protocols. If you're working in a paramedic agency, you need to be familiar with those laws and regulations. If you work with a paramedic partner, you need to be familiar with those also. All right, federal legislation also focuses on guaranteeing standardization of doses. Standardization assures patients when they take a medication with a stated amount of the active ingredient that they will receive the amount of the drug. So for a drug to carry a USP label, amount of active ingredients must be within 95 to 105% of that stated on the label. All right, the FDA enforces Food, Drug, and Cosmetic Act. It determines safety and the efficacy of the drugs before they are allowed to hit the USA market. It also holds the regulatory oversight authority regarding the safety and effectiveness of vaccines used in the United States. All right, the DEA executes provisions of the Controlled Substance Act. This includes registration of physicians who are permitted to dispense controlled substances, and the Federal Trade Commission monitors drug advertising and ensure that it is not misleading or inappropriate. Okay, so these are all the agencies you could possibly deal with if you do have a mess up. It takes several years for drugs to be commercialized and to be able to be used out in the general public. It's an average of about 9 years. It goes through a lot of testing. A lot of animal studies are done. And testing in at least 2 animal species is required by law. So this is not a simple process. Usually drugs are being talked about, new drugs, long before they actually hit the market. Here's your different phases that it goes through. So, and like I said, on average, it's about 9 years. Drug containers should be guarded against possible theft. They need to be locked, secure within the ambulance itself. You need to know where they're at all times. If you leave your ambulance, you need to make sure that your ambulance is locked, and that includes the patient compartment doors and any doors that can get into your patient compartment. If you store drugs inside of your home base, you need to make sure that those doors are locked to get inside of it also. Potency of medications is affected by temperature, light, moisture, shelf life, and exposure to air. Certain medications are in darkened containers. Certain medications are in clear containers. Certain medications cannot be exposed to cold. This is why when, here in the South where we're at, in Southeastern North Carolina, our weather is it's sometimes we wonder if we got a mental illness with our weather. It's when I'm recording this right now, it's first day of March and we had 25-degree nighttime temperatures with a freeze. And the plants are starting to bloom. So, we have to be very careful where our drugs are at, make sure that we take them inside if we have to leave our ambulances outside in the cold air, so that, they're not being affected. Expired control medications need to be destroyed and they need to be witnessed by 2 employees and documented appropriately. All right. Pregnant patients' suspected benefits of a drug should be considered against possible risk of the fetus. So always remember that you're treating 2 patients there. And a lot of medical providers, simply put these patients on Tylenol, ibuprofen as much as possible. And even those 2 drugs can have potential harm to the fetus itself. Okay. When you're in doubt, always contact medical control, and even your ER physicians are probably going to refer you to an OBGYN if they're on call for the hospital. All right, pediatric patients, these medications have different effects on children. So they have reduced metabolic capacity. So children can metabolize some medications quicker than adults. So we may decrease the dosage of these drugs so that they're not getting the full-blown possible effects of them. Geriatric patients, hepatic functions and gastrointestinal activity slow, delay absorption and elimination. A lot of times these geriatric patients are taking a whole list of medications. This can cause toxicity to build up within their bodies because they are not excreting them and not eliminating them, possibly due to decreased liver capabilities, kidney capabilities. So you have to be very careful about their therapy also. All right, you're legally, morally, and ethically responsible for each drug you administer. It needs to be safe and therapeutic, and always keep a field guide or other reference handy. If you're in doubt, please make sure you look at your protocols to make sure you're given the correct dose. Okay. They can have effects on the body system, the class of the agent, and the mechanism of action. So it can have an effect on your central nervous system, your peripheral nervous system, your autonomic nervous system. So you need to be able to make sure that you know how it's going to act, when it's going to act. Is it going to cause that fight or flight response to occur? So. Our hormones are released by the sympathetic system stimulation. So you've got your 4 response target organs also, your alpha 1s, your alpha 2, your beta 1 and beta 2s. So know the sympathetic mimetics of the sympathetic nervous system. So, and then it could possibly inhibit the sympathetic nervous system, or also known as an anti-adrenergic. Antagonists and counteract the action of something else, and agonists bind to the receptor and cause a response. All right, beta blockers are used to control the blood pressure. Beta 2 selective drugs cause bronchodilation. Parasympathomimetics, a agonist against the parasympathetic nervous system, and they're also called cholinergic medications. Cholinergics are, if they're excessive, they're present, we're going to look for the sludging system, and that's salivation, lacrimation, urination, defecation, drooling, diarrhea, gastrointestinal upset and cramps, emesis, and possible muscle treatment. Twitching. Parasympathetics are agonists against parasympathetic nervous system. So it's also your anticholinergic medications, and atropine is one of those. Um, so, our analgesics are relieve pain and induce analgesia or a sense of pain relief. And opioid agonists similar to derived from the opioid plant, and they're CNS depressants. So fentanyl is one of your opioids. Non-opioid agents, antipyretic properties such as Tylenol, ibuprofen, they can reduce fever. NSAIDs also such as ibuprofen. So Narcan reverses is an anti-agonist, and it reverses the effects of opioid drugs. So anti-anxiety sedative hypnotic drugs help a patient possibly sleep through medical procedures by producing sedation or hypnosis. So a lot of these are benzos, barbiturates, opioid agonists, non-barbiturate hypnotics, and dissociative anesthetic agents. Anticonvulsants are used to treat seizures. They are believed to work by inhibiting the influx of sodium into the cells. Stimulants excite the central nervous system. So they increase the release of dopamine or norepinephrine to increase wakefulness and awareness. So high doses can cause increased nervousness, irritability, tremors, and headaches. Some of these can be cocaine, coffee, or illicit amphetamines. Depressants slow the brain activity. They may be prescribed or treat anxiety, muscle tension, pain, insomnia, stress, panic attacks, and seizures. Some examples are Valium, Ativan, Xanax, and Ambien. Psychotherapeutic drugs block dopamine receptors in the brain. They're used to treat such things as schizophrenia and depression. So you got your SSRIs, your MAOIs, and your TCAs. Your cardiovascular system has it can be positive or negative. So your chronotropics affect the heart rate. Your inotropics change the force of contraction. Your dromotropics alter the velocity of the conduction of the electricity through the heart. And all these can be positive or negative. All right, cardiac glycosides derived from plants. They block certain ionic pump cells membranes, which indirectly increase calcium concentrations. Your antiarrhythmic medications can have a direct or indirect effects on cardiac tissue. So sodium channel blockers slow the conduction through the heart. Beta blocker reduces the adrenergic stimulation of beta receptors. Your potassium channel blockers increase the heart's contractility, and calcium channel blockers decrease the force of contraction and automaticity. Antihypertensive medications, diuretics can cause kidneys to remove excessive amounts of sodium in water, salt in water. Vasodilators act as a smooth muscle of the arterioles and veins. And sympathetic blocking agents include beta blockers, diminish the effect of the beta stimulation. Your ACE inhibitors target the renin angiotensin aldosterone system. All right, anticoagulants, thrombolytics, and blood components. Antiplatelets interfere with aggregation or collection of platelets. They do not break down aggregated platelets and prevent further buildup of these cells. Anticoagulants work against the coagulation to prevent formation of thrombi, and they may be prescribed on a long-term basis as a preventative measure. And then fibrolytics dissolve the thrombus, and prevent it from breaking off and entering the bloodstream. All right. Respiratory system oxygen is one of the most common ones. Over-the-counter decongestants, um, um, pseudoephedrine, antitussive, um, and Benadryl. So many of these respiratory emergencies use sympathetic mimetic medications, so they stimulate the beta 2 receptors. Xanthines are the second line treatment. They relieve airway constriction by relaxing smooth muscles, and then they increase the blood flow. And then corticosteroids could be used to suppress the inflammatory response. Pancreas hypoglycemic medications are available. Some of them act on the pancreas directly. Others alter the way the insulin is used by the body. But then insulin sensitivity is increased by oral hypoglycemic agents. Immunosuppressant medications often prescribed the patient to undergo an organ transplant and have an autoimmune disease. So they intend to inhibit the body's ability to attack a foreign organ or attack itself. Vitamins and minerals are necessary substances that allow for normal metabolism, growth, and development and cellular function. These supplements may be taken to replace deficiencies and also possibly as a preventative measure. Thiamine is sometimes still used in the pre-hospital setting with our certain population of patients. So it aids in converting carbohydrates into energy. All right, fluids and electrolytes, we have isotonic. This is a stable medium for the administration of medications. We have hypertonic, it helps provide nutrition. And we have hypotonic, and it's beneficial in dehydration situations. All right, drug forms. A form that a medication comes in is usually determines its route and administration. So it ensures proper route for the medication, timing and release it into the bloodstream, and effects on the target organs and body systems. So solid drugs can be capsules, tablets, pills, and suppositories, and all those are shown here. Liquid drugs can be solutions, suspensions, tinctures, spirits, elixirs, syrups, and emulsions. So please make sure you review those. Middle dose inhalers, albuterol is one of our most popular middle dose inhaler, and they're usually prescribed with patients with a respiratory illness. Topical medications applied to the surface of the skin, so they could be lotions, creams, or ointments. And transcutaneous medications may be transdermal, absorbed through the skin, and it's usually intended for systemic effects. Gels, here your oral glucose, and paste and creams. Gases are usually delivered in the operating room. So oxygen is one that we use. Nitrous oxide could be used to help reduce pain, but we don't have it as much on the truck. All right, the routes. The enteral routes include oral and rectal. We don't do a whole lot of rectal administration at advanced AEMT level. DPT might be one, but it's got to be approved by local protocols and policies. All right, our parenteral medications could be IV, IM, subcutaneous, IO, sublingual buccal, transcutaneous, transdermal, and intranasal inhalation drugs. And I'm sure throughout your skill session, you'll learn more about these. IV is the fastest, and then your dermal, transdermal, It's probably the slowest. So pharmacokinetics, drug absorption, drug distribution, um, drug biotransformation, and drug elimination, how it's going to come out. So how fast it absorbed, what's the effect it's going to take on the body, where it's going to go, how it's going to go, what if on our organs, how it's going to be transformed through the body and in the cells, and how it's going to be excreted. Pharmacodynamics is a way in which the medication produces the response we intended. It also includes factors that may alter the intended response and any side effects or unexpected effects. All right, its mechanism of action, at its appropriate concentration, how it binds to a receptor, it changes the physical property of the cells, and it chemically combines with other chemicals. So after medication is bound to the receptor site, it initiates a chemical change that produces the expected effect. Drug response relationship correlates to the amount of medication given and the response it causes. So when administered medications, like the onset of action, the duration of action, and termination of action. All right. So please make sure that when you're given a medication, you know this paragraph right here. You need to make sure you know the rights to medication administration. If you don't, you don't need to be administering that drug. Please remember that patients do have the right to refuse if they don't want to be given, but you need to make sure that you got the right documentation of that refusal. So we want to reduce medications errors. So, and then we can evaluate the hypersensitivity for each medication administration. Okay, if you're given nitro, you need to know the side effects of nitro. And you need to know that if your patient has taken other types of medications, that they need to admit to it. And if they don't, and they have an adverse reaction, you need to be able to document it. So, all right. There's a list of medications that you can possibly give as the advanced AEMT. Please make sure that you're familiar with your list and your local agencies, and each one for each particular agency that you work for. Some agencies allow advanced AEMTs to give certain drugs, and then other agencies don't. So please make sure that you're familiar with your local protocols.